I think one thing that we know with the new generations and like now there are many more women in medicine. I mean, actually, like if you look at the data, almost 51% of medical schools are female medical students. And so the profession has really changed. Are there disadvantages of being a woman? There definitely are. I mean, if I enter a room and I introduce myself as the doctor, 90% of the time I'm going to be say, oh, the nurse is here. So then I correct them. Or if I enter a room with a medical student who's a male who may happen to be a little bit taller than me, it's happened to me multiple times. They will talk to the male resident or the male student without focusing and talking to me. And so then I, of course, redirect. So I think like there's some challenges in like societal's view of who really, what is the view of a physician? Like, what does a doctor look like? There's definitely a lot of challenges as far as like looking at like pay. There is definitely still a pay gap between females and males in medicine. And there's definitely a gap in the women that make it to like the higher levels of like administrative roles. So like there's something kind of called the C-suite, which is like the kind of the CEO, CMO, CFO, like that kind of like higher echelon of like the hospital system or the medical system. There are fewer women that are in that position that are from like a physician or medical background. So I do think like there's a lot of opportunity that we need to push forward. It happens. I think that it's become more evident in the last 5 to 6 years. And I'm not going to tout like my political views, but I think there was a lot of change in the last couple of years that really brought a lot of things that maybe were under the surface. That's come up to the top, to the top of that.